Thank you for joining me today. In this video, you will learn more about Prozac. And I have a case study based on Prozac. A 25 years old female presented to the primary care, accounted by a concern of persistently low mood. So she has a low mood and she has decreased function over the past 4 months. She has a low mood and low energy and low motivation. She is college student working her first year and first job and reported difficulty adjusting to her new routine and expectations. Her past medical history is unremarkable. She has no prior psychiatric hospitalization and no history of a substance abuse. So she don't have none of that. Her family history is significant for major depression in her mother. So her mother had a major depression disorder. She is not currently taking any medication and she denied being pregnant. So some of the symptoms she presented with include persistent depression, mood most of the days. She also presented with loss of interest in previously enjoyed activity. She has a fatigue and low energy. She has a difficulty concentrating at work and school. She has changed appetite and mild weight loss. So her appetite is low and her weight became lower. She lost some weight. She occasionally feels overwhelmed. She denies suicidal ideation, self-harm, manic symptoms, or psychosis. Sleep is mildly disturbed. She reported her sleep is interrupted mildly with difficulty maintaining sleep. Her mental status examination revealed a flat affect, depressed mood, normal speech, linear thought process, and good insight and judgment. Based on the history and symptom duration and functional impairment, the patient meets the diagnostic criteria for major depression disorder and moderate severity. Screening with the PHQ-9, which is a depression scale that you will use for depression, is confirm a moderate depressive symptoms. No pharmacology strategy alone were felt to be sufficient given the symptoms and impact on daily function. So Prozac was selected as a first line of pharmacology treatment due to the following. Prozac has a strong evidence base for treatment of a major depressive disorder and is favorable because the side effects for the young adults It has a low risk of sedation, low risk of weight gain compared to other antidepressive. It has longer half-life, reduced risk of withdrawal. Also, a daily dosing support adhesiveness. After shared decision making, Prozac was initiated at the lower starting dose with the plan of a gradual titration. So patient education include Prozac is selective serotonin reuptake inhibitor SSRI and used to improve mood, energy, and interest in a daily activity. That's what you will teach the patient. You will teach them the onset of the medication. Mood improvement may take 2 to 4 weeks with a full effect of 6 to 8 weeks. So you will feel fully recovery at 6 to 8 weeks. Side effects of a Prozac include nausea, headache, sleep changes, increased anxiety in the early treatment. Safety consideration include report worsening mood, agitation, suicidal ideation, especially during early treatment. Avoid interrupting or discontinue this medication. Avoid combining with other serotonin with SSRI's medications without provider guidelines. Pregnancy consideration: notify the provider if a pregnancy is planned or occur. So if she's planning to get pregnant, she has to notify her primary care, or if she become a pregnant, she has to notify the primary care. Patient understand the treatment plan and agree to start the treatment. So you will monitor improve in a depressive symptoms using the PHQ-9 score. You want to assist the sleep, appetite, and energy changes. You wanted monitor anxiety, agitation, suicidal ideation. You wanted also encourage to take the medication and tolerance. You want to monitor if the patient is tolerating the medication and if they are adhesive to the medication. No lab monitoring required. Base lab referred due to absence of comorbidity. She don't have no comorbidity. You will monitor sodium level if clinically indicated, like this symptoms. If you see symptoms of low sodium, you will check the electrolytes for that. Outcome of the treatment: at the 6 weeks, you will have follow-up appointment within the 6 weeks appointment, and you want to see improve the mood, energy level, increase motivation, work productivity, improve the sleep and quality. You want to see gradually of interest in a social activity. She will be interested in social activity. She will report mild nausea during the first week of treatment, which resolves without intervention. No suicidal ideation or mood worsening was reported. BHQ-9 score decreased to mild range. So you want to have a follow-up plan, and that is continue Prozac at the current therapeutic dose, encourage participation in a cognitive behavior therapy as added to the pharmacology. Schedule a follow-up appointment within 6 weeks to assess the symptoms control and side effects. Plan to continue the pharmacology treatment for at least 6 to 12 months following the symptoms remission. Patients are advised to contact the clinic immediately if the mood worsens or concern of side effects. You will encourage them and educate them to contact the clinic if they feel any of these symptoms. Thank you for joining me today. Please subscribe and join me in my next video. Thank you.